All right, let's talk a little bit about pain control after surgery. So at the time of surgery, the anesthesiologist is going to work with you to control the pain during surgery and immediately after. We do nerve blocks, sometimes spinals, different ways to try to decrease the amount of pain that you're having. And then in the hospital, we'll of course treat with medications. As you go home, there are 4 medications we will send to your pharmacy that you're going to use primarily for pain control and treatment afterwards. The first one we'll talk about is a newer medication called Journavx. It is a medication which blocks sodium channels throughout the body, so it's kind of like putting a local anesthetic throughout your whole body. Studies have shown that it is as effective as narcotics in controlling surgical pain, and we've had a lot of great success with it. So we will prescribe that in your preoperative visit, and you'll be able to pick that up before surgery. This medication works best if you take 2 pills to start out with. So it's usually 1 pill twice a day, but your first dose is going to be 2 pills. And we want you to take that as you are heading into the hospital for surgery. That will just help with your pain control during surgery and after. And then once you go home, you'll take that medication as well. We also want you to bring it with you because you'll use it in the hospital that night, the next morning, and then you'll just continue that twice a day taking the medication, and that should take care of most of your pain. In addition to that, we're going to send in Celebrex, which is an anti-inflammatory. Now, with some of these operations, we talk about not taking anti-inflammatory medications after surgery. Taking this medication for 5 days, twice a day, is safe. We won't extend it beyond there, but we do want you to take it twice a day for those 5 days once you get home. So that's another medication we're going to send in for you, and that's the Celebrex. Continuing on the theme of pain control, it's okay to take Tylenol, and we would encourage you to take that pretty regularly up front because that will also give you some baseline pain control. If all of that together doesn't work, there are some non-medication options. Ice works well for incisional pain. Heat works well for muscle pains if you feel like those muscles are cramping up. And then if even beyond that you need something additionally, then we can send in a prescription for some narcotics. I will tell you the vast majority of patients with those non-narcotic methods, they do just fine and they feel fine and pain is controlled and they do really well. A lot of times patients will complain that the right side of the abdomen hurts more than the rest. That's because that's where our largest incision typically is, and often with that incision we have to put some stitches in the muscle, and that's why that one hurts the most. So that's to be expected. Now there are 2 other medications we're going to send in. One of them is a nausea medication. So sometimes surgery can create the nausea or anesthesia can create nausea. If you have to take a narcotic, that can create nausea. So for any of those reasons, we want you to have a medication just in case. So that's Zofran or ondansetron is the medication that we will send in for your nausea. And then the last medication that we will send in is omeprazole, which is an acid blocking medication. Now, you may already be on an acid blocking medication, and if that's the case, then just keep taking the medication you're taking. But we want you to take that for 3 months after surgery. What that does is it helps decrease the acid in the stomach, and that helps with the healing of that stomach and decreases the risk of ulcers after some of the operations. So you'll take that for 3 months, and then most of the time you can come off of that medication afterwards. In some situations, there will be another medication that we will prescribe, and the one that is a blood thinner, either Lovenox, which is an injection, or Eliquis, which is a pill. We use that medication for patients who are at higher risk of developing blood clots. So blood clots in the legs that can go to the lungs, we want to prevent those. And so we will sometimes use blood thinning medications. So there are some calculators we use to try to decide if somebody is at higher risk, or if you've had blood clots in the past, or you're already on one of these medications, then we'll work with you to resume those medications, trying to decrease the risk of blood clots. Of course, we have to balance that with the risk of bleeding after surgery, so we'll work with you on that, but that's one other potential medication you might be prescribed. So, several medications that we will send into your pharmacy at your pre-op appointment. A couple of those centered around helping with pain control, and then all of these things to help you get through that recovery process as smoothly as possible.